Hey everyone, Dr. Luke Peterson here, physical therapist with the Knee Replacement Therapist. In this episode of the Need to Know Show, we're going to talk about 3 of the biggest mistakes to avoid when it comes to your knee replacement, physical therapy, and rehab. Hi everyone, Dr. Luke Peterson here, physical therapist. So today we're talking about 3 of the biggest mistakes that I see when it comes to your rehab and recovery and physical therapy after knee replacement surgery. So in this video we'll talk about 3 of the mistakes, and then I'll make a part 2 where we'll talk about another 3 mistakes that I thought of, and we'll have a total of 6 different mistakes and big mistakes that are important to avoid to help make your knee replacement recovery efficient and effective. So let's hop right into it. So number one mistake is failure to prepare. And what I mean by this is failure to prepare prior to your knee replacement surgery. So you might hear this referred to as pre-op physical therapy. Sometimes people combine it together and call it prehab. But basically preparing yourself before surgery through physical preparation, physical therapy, exercises, physical activity, but also mental and psychological preparation, and also preparing your home and your environment for after knee replacement surgery is very important. And people who prepare prior to surgery, one, they know what to expect with both the surgery as well as the rehab and recovery process after surgery. And there's a number of studies out there that look at people who perform these prehab or these before surgery exercises and physical activities, and their outcomes after surgery are much better. There's much more efficient return of range of motion, a return of strength, return of your function and your mobility and your ability to walk and do the things that you enjoy. It just makes your overall recovery and rehab a lot more efficient the more you're able to prepare yourself prior to surgery. So mistake number 1 is a failure to prepare, a failure to do those prehab exercises to prepare yourself mentally and psychologically, and also preparing your home environment as well. That's mistake number 1. Mistake number 2 is not having realistic expectations. So there's 2 different ways to look at it. So one is realistic expectations in terms of how long the recovery process is going to be and what the recovery process is going to entail. A lot of people will look at knee replacement surgery and they'll see, I'll have the surgery and then I'll have physical therapy for maybe 6 weeks, 8 weeks, maybe on the higher end 12 weeks, and then after that I'll be recovered and I'll be good to go and feel like brand new. But the reality of that is, for of course those of you who have gone through the knee replacement process or are different stages after your surgery, is the actual recovery after surgery is going to be much longer than that. Your physical therapy and your rehab might be just a number of weeks, might be 8 weeks, 12 weeks, maybe a little bit longer. But once you're discharged from physical therapy, in the vast majority of cases, you aren't necessarily 100% recovered and back to normal yet. You're still going to have symptoms. You're going to have some pain. You're going to have swelling, stiffness. Hopefully these things are starting to decrease and be less frequent and less intense day after day over time. But those symptoms can still linger for 6 months, for a year, maybe up to 2 years, or even a little bit longer for some people. Those symptoms can linger, and that's very normal. And also, the thought that you're going to be 100% recovered at 12 weeks after surgery is not a realistic expectation. You want to think about this is a prolonged recovery. You have to be patient, you have to be consistent, and let your body heal and recover and adapt and get stronger. So, it might take you 6 months, 12 months to really get that last 15, 20% of recovery to really feel like you're totally recovered. And then the other thing about having realistic expectations is about what can you do after knee replacement surgery. So the good thing is, for the vast majority of people, you're going to be better off. You're going to be more active. You're going to have less symptoms. You're going to be able to do more things that you want to do. You're going to feel better and have better mobility for the vast majority of people. The thing to keep in mind, though, is the best knee that you have, the best knee out there is the one that you have and the one you were born with. So just because you get a knee replacement doesn't mean it's going to make you a young, teenager or 20-year-old or whatever you want to think of. There's still going to be some limitations in what you're able to do. And so people sometimes come in with these super high expectations that are unrealistic, and that's going to set you up to being, disappointed. You definitely can accomplish a lot and do a lot and be very physically active and participate in all sorts of things after surgery. You can get back to hiking, walking, cycling, swimming, running a little bit sometimes, playing tennis, skiing. There's a lot of things that you can do after knee replacement surgery, but at the same time, you have to have those realistic expectations. It's not going to be a completely, 180 reversal, feel like nothing ever happened, you never had arthritis or any symptoms at all ever. So maintaining that realistic expectation is important to avoid any type of frustration or negativity or feeling like you didn't have the outcome that you wanted from surgery. So that's mistake number 2. For number 3, the last one for this video, we're going to talk about not controlling pain after surgery. So this is very important, especially early on after surgery. So that day of surgery, first few days after surgery, as well as probably the first couple weeks or so after surgery, it's still very important, and throughout your recovery. And what we're talking about is staying on top of your pain. So controlling it, managing it. The phrase is, it's easier to keep the pain away than it is to make it leave. So, it's easier to take your pain medicine when you're supposed to, when it's scheduled for you to take it. It's easier to take the additional medicine, maybe Advil, Tylenol, or both, taking that when appropriate as well and staying on top of it that way. Using non-pharmacological, non-medicine type of pain management strategies, range of motion, stretching, heat and ice, using, self-meditation and self-talk and mantras and things of that nature as well. Elevation, compression, all these things play a role in managing your pain. But the take-home message, the important thing is that you need to control your pain and stay on top of your pain. Don't just let it run wild and do whatever. The main reason for this is when it comes time to have your physical therapy or to do your exercises or to walk or whatever it may be, and you have such extreme, excruciating pain that it's going to make it very, very difficult for you to be able to or even want to do these activities that are going to be very important for you to do after surgery, because it's going to be important to get that range of motion, to start to build that strength up, and do that soon before that scar tissue starts to set down, before you start to lose that range of motion. So staying on top of your pain, controlling your pain is extremely important when it comes to being able to tolerate physical activity, physical therapy, your rehab and recovery exercises and things that you have to do to manage your knee and to avoid setbacks, to avoid being stuck at a range of motion and developing that scar tissue, or to have that muscle weakness and atrophy. You have to stay on top of the pain. So those are my 3 for this video. So again, we said failure to prepare, not having realistic expectations, and not staying on top of or controlling your pain. Those are 3 big mistakes that I see with people who are going through the knee replacement, rehab, and recovery process. And if you can avoid those mistakes, it's going to help make your recovery that much more efficient and effective, and have you send you on the way to a great outcome from your knee replacement surgery. So thank you very much for watching, everyone. Be sure to check out part 2 of this video with 3 other mistakes that I will share that are very important as well. As always, be sure to subscribe, leave your likes, leave your hearts, Send us a comment or a question. I try to respond to everyone I see. And thank you very much for watching, and have a great day.